So there's no doubt that pandemic influenza preparedness is complex, and there are many issues associated with preventing the next pandemic influenza outbreak. And along with that, I should say, comes the risk of siloed approaches to preparedness. So to talk to us today about unifying themes for pandemic influenza preparedness is Dr. Jacqueline Katz, who is the Deputy Director of the Influenza Division and Director of the World Health Organization's Collaborating Center for Surveillance, Epidemiology, and Control of Influenza at the U.S. Centers for Disease Control and Prevention. Dr. Katz actually joined CDC in 1992 as the Chief of Immunology and Viral Preparedness Section in the influenza branch at the Division of Viral and Rickettsial Diseases. And from 2006 until 2014, she was also the Chief of the Immunology and Pathogenesis branch of the Influenza Division. She's been a board member of the International Society for Influenza and Other Respiratory Diseases since 2007, as well as the Deputy Chair since 2012. Please join me in welcoming Dr. Jackie Katz.
So thank you for that introduction, and thank you to the organisers for asking me to give this talk, which is a little outside what I normally do, but my focus and my task today is to give you a One Health perspective and why that's important in pandemic influenza planning. Let's see if I can, okay. As we've already heard from a number of our speakers, animals, avian species and swine are the reservoirs of the influenza viral genes that have contributed to past pandemic viruses and will no doubt contribute to future pandemic viruses. In the last 100 years, we've had 4 pandemics, and all of these pandemic viruses have genes that originated either from avian or swine or both species. For the last 3 pandemics, we know for sure that a reassortment, a mixing of genes within a common host created the virus that could then infect humans and undergo sustained transmission in an immunologically naive human population, resulting in a pandemic. So in the last 20 or so years, we've had an increasing number of what we at CDC refer to as novel influenza A virus infections in humans. So a novel influenza A virus infection is essentially a zoonotic infection. It's an influenza A virus that has jumped from an animal source into humans and is distinct from the viruses, the seasonal viruses that are circulating currently in humans. You can see with this timeline, an ever-increasing variety of subtypes that have been derived either from avian species or swine, and of course the most recent pandemic in 2009 being derived from a swine source, but that virus having genes both from avian and human as well as swine origin. So I want to focus a little bit first on the Hong Kong outbreak in 1997. I think this was the first realization that a wholly avian influenza virus could infect humans, and in fact it caused 18 cases with 6 deaths. And I think it was the first really development of a modern day One Health approach for influenza. The surveillance and molecular epidemiology that occurred in the birds in the poultry markets and in the wild bird populations really provided the evidence that of the H5N1 virus origin and its evolution and its ability to transmit from a bird to a human source. Joint studies at the surveillance at the animal-human interface provided serologic evidence of additional human infections with H5N1 amongst the poultry cullers and the market workers at the time. And these studies provided firm evidence that exposure to poultry was the main risk factor for H5 subtype human infections, and that remains true today for the H7N9 virus as well. There was close collaboration between human and animal sectors that ultimately curtailed the human disease outbreak. Through the culling of all the poultry at the end of 1997, that stopped the transmission of the virus to humans and stopped the human cases. And Hong Kong has been very active since that time in developing and sustaining long-term strategies that safeguard not only the economics of the poultry industry, but also follow safer practices in terms of buying live birds and the processing of live birds at markets, which has also protected human health. And really, the establishment of these approaches as a One Health strategy really helped in the emergence of other diseases such as SARS. So since 1997, we've seen even greater explosion, a twofold increase in the global population of poultry, as well as a steady increase in the number of pigs that are farmed globally, and a very steep increase in the number of people as passengers moving globally. So all of these factors combined probably contribute in part to the increasing number of human cases of novel influenza A viruses that we've seen since the mid-1990s. There's no doubt that increased and improved surveillance has also a component here. But we can see from this slide that the black line represents the H5N1 infections in humans that Dr. Kooka introduced. But you see by the red line, the number of H7N9 cases has now far exceeded the number of H5N1. And I think you've also seen this from Dr. Kooka's presentation. I just want to highlight again that this, for H7N9, this represents the 6 waves that we've seen of human disease, which is closely correlated to the winter months when the poultry have a high infection rate with the H7N9 virus, with the largest wave being in the 2016-2017 fifth wave. And the emergence of highly pathogenic avian influenza H7N9 viruses, which had not been seen in the previous waves, really prompted the Chinese government to introduce poultry vaccination for H7. And so controlling the virus in the poultry population essentially controlled the disease in humans. We've also heard quite a bit about influenza viruses in swine that continue to infect humans. We refer to these viruses as variant viruses once they have infected humans. And we've seen this over the years, with the largest waves being in 2012, when we had over 300 infections of H3N2 variant viruses occurring primarily in children, and with a close association with children showing swine at agricultural fairs, or being in the context of the swine events at these seasonal state fairs. And this continues to be a pattern, although the numbers that we see vary by year. So what is the global surveillance and response system, WHO's GISRS system, able to do about surveillance, and how do we engage with our agricultural and veterinary sector partners? So GISRS, the Global Influenza Surveillance and Response System, is continuously monitoring not only seasonal viruses, but also novel influenza A viruses that cause zoonotic infections. And these are H5, H7, H9 subtypes from avian species, as well as the H1 and H3 variant viruses that are caused from swine. So GISRS works very closely with a group called OFFLU, and this is a joint OIE-FAO animal influenza expert group. And this group together shares reagents and supports the antigenic and genetic characterization of animal viruses. And this is very important to GISRS, that mostly focuses on viruses that come from humans. The OFFLU group allows access to characterization of viruses from animal sources that would not normally come to WHO. So this partnership is key in tracking the viruses in animals and how they emerge as zoonotic infections in humans. So every time we meet to make recommendations for the seasonal vaccines, we also get an update and look at data on human epidemiology of the zoonotic infections, the distribution and the ecology in the animals, and then the joint genetic and antigenic characterization of viruses from both human and animal sources. And as Yoshi Kuoka commented earlier, we know of genetic markers that are associated with enhanced adaptation to mammals and the potential for these viruses to be able to transmit and cause a pandemic. And Yoshi's elegant studies have identified some of these. So we also follow genetic markers in these viruses as they emerge to see if they are acquiring additional adaptive changes. So this analysis also provides a rationale for the development of candidate vaccine viruses. And this, I guess, is what Dr. Fauci referred to as chasing the virus. But without a universal vaccine, that's what we have to do. And so this analysis that is conducted year-round provides a rationale for candidate vaccine viruses that need to be prepared in the event that one of these strains would cause a pandemic. So the collaborating centres and the essential regulatory laboratories of GISRS have generated over 60 candidate vaccine viruses. Most of these are just sitting there ready in case we need them. Some of them are produced as pilot lots, and NIH will conduct clinical trials, and that provides important information about how these vaccines would work in humans and what doses we would need and whether we would need adjuvants or not. And interestingly, some of these CVVs have also been used by veterinary vaccine producers. So we go full circle, and candidate vaccine viruses that are produced under the WHO and the public health purview are also helping veterinary health. So to focus a little bit on One Health just in the United States, we have a very close engagement with the USDA. So human infection with novel influenza A viruses has been a nationally notifiable disease since 2007. And if the disease is in humans, CDC and the states, or the states themselves, investigate and report the cases. If there are associated animal infections, then the animal samples would go to the USDA's National Veterinary Service Laboratories, and they would characterise these viruses. Importantly, USDA and CDC have a very fluid communication where we exchange genetic sequence information, whether it be the human virus or the animal virus, as well as the epidemiology. And this helps link the animal and the human cases. So we've also developed protocols for notification and response when either health sector identifies potential zoonotic events. We've developed a public health monitoring plan together with USDA to monitor responders in avian influenza poultry events where culling or cleaning up activities are needed, with the goal of timely identification of potential human cases so we could provide prompt medical interventions. And then we also work with USDA to develop educational materials and other guidances for either animal sector producers or the public. And two nice examples of this really target youth agriculture and the 4-H groups in the United States, where there's multiple partnership projects at the state level that CDC supports. And most recently, the publication of a graphic novel which describes the Operation Outbreak, a junior disease detective with, we've done this in collaboration with 4-H, and it's really an outreach to both the 4-H community as well as the teaching community, and it's a teaching tool for the importance of understanding variant influenza virus and the process for investigating these outbreaks. So what's next in terms of surveillance? We have, since late 2014, really expanded our next generation sequencing capacity. We have pilot studies where we hope to promote next generation sequencing in different international sites, but perhaps the most exciting thing, I think, that CDC has partnered with Andy Bowman from the Ohio State University, who is a long-time investigator of swine influenza and outbreaks, particularly at swine influenza in the context of the state fairs. And we had the opportunity to partner with Andy Bowman and go out to the World Pork Expo in Iowa in June. And this is what's known as a jackpot expo. And it's believed that this is where the influenza viruses in swine each season really get spread amongst the swine. These are the huge shows with quite significant sums of money involved in the various competitions. So swine from all different states come to these jackpots, and then later in the season, these swine then go back to their states and are shown at particular agricultural fairs. So we were able to attempt to use our first field test for a mobile influenza sequence analysis using the Oxford Nanopore MinION, which you can see there is just something you can hold, the size of something you can hold in your hand. And they set up a site right there in the barns at the World Expo and essentially sequenced in real time viruses that were found in the swine, and these sequences were similar to the viruses that we eventually found a few months later in humans coming from the state fairs. Why do we want to do this? We want to do this so we can have one jump ahead, and potentially from the genetic sequence that we find early in the season, we can already prepare a candidate vaccine virus just from that sequence alone. And then if you translate that to the human setting, we have the possibility of doing this in a real time in a human outbreak setting. So there are a number of global health challenges. There's really insufficient surveillance in many regions of the world in animals, and this is because of trade and export implications. We still have challenges with virus sharing, as we've heard. There are very complicated processes for sharing viruses, different regulations that involve multiple sectors. This happens in the US, it happens in China, it happens in many places. And the Nagoya Protocol adds an additional layer of concern. So I'm just going to finish with a very brief discussion of the influenza risk assessment tool that Dr. Kuoka mentioned. This is something that CDC developed several years ago to really try and in the pre-pandemic setting, assess the risk of a virus either emerging as a pandemic virus, and if it did emerge, what would its severity be? And the idea is to enhance our readiness and prioritise appropriately. And again, this is a One Health approach where the human subject matter experts work together with our agricultural experts. I don't have time to go through, but there's a number of 10 different elements that we assess, and these are properties of the virus itself, the population, or the ecology in animals or in humans. And I think Yoshi also showed this, that this is of about 10 or 12 viruses that we have assessed over the last several years. H7N9 remains our highest risk, both for emergence and for impact, followed not too far behind by the H5 subtype viruses. So in conclusion, the number of zoonotic influenza virus infections in humans is increasing. Coordination between human and animal health sectors is essential. And as I've just mentioned, H7N9 remains our greatest risk. Recently, it's been determined that highly pathogenic avian influenza H7N9 has now extended its host range into ducks. Strong collaboration between human and animal health sectors is essential, and this at the technical level at least is working well globally and domestically within the US. But there are countries around the world where there are still silos, and the human and the veterinary sectors really don't have a relationship, and in the event of an outbreak, this would be problematic. And lastly, virus sharing still remains an issue. There are many challenges because of the regulatory requirements, and at least in the United States, we work closely with USDA to streamline the importing and transfer of viruses. So I'll leave it there. Thank you.